let me introduce myself. My name is Marcelinus Revian, 22nd Management Class, study number 2241102X, where I will explain material about health and safety at work. Definition of occupational health. Occupational health refers to the branch of public health that is concerned with the well-being, safety, and health of individuals in the workplace. It involves the identification, assessment, and control of factors in the work environment that may cause illness, injury, or impairment. The goal of occupational health is to promote and maintain the highest degree of physical, mental, and social well-being of workers in all occupations. Next, the importance of occupational safety. Number one, worker well-being. The primary concern of occupational safety is the health and well-being of workers, ensuring a safe work environment reduces the risk of accidents, injuries, and illnesses, contributing to the physical and mental health of employees. Number two, reducing workplace injuries and illnesses. Implementing safety measures and guidelines help prevent workplace accidents and reduces the incidence of occupational injuries and illnesses. This in turn lowers the personal suffering of employees and the associated costs for medical treatment and rehabilitation. Number three, enhances productivity. A safe workplace contributes to increased productivity when employees feel secure and are confident in the work environment. They are more likely to focus on their tasks, leading to higher efficiency and better overall performance. Number four, cost savings. Occupational safety measures can result in substantial cost saving for organization. Fewer accidents mean reduced workers' compensation claims, lower healthcare costs, and decreased expenses related to absenteeism and employee turnover. Next, risk identification and evaluation. Number one, hazard identification. Conduct regular workplace inspection to identify potential hazards. This includes physical, chemical, biological, ergonomic, and psychological hazards. Involve employees in hazard identification through regular communication, feedback mechanisms, and training program. Review historical data on workplace accidents, injuries, and near misses to identify patterns or trends. Number three, risk assessment. Assess the severity of identified hazards, determine the potential consequences if an incident were to occur, evaluate the likelihood or probability of the hazard leading to accident or injuries. These risk metrics are similar to categorize risk based on their severity and decreases, helping prioritize action. Number three, prioritization of risk. Priorities identify risk based on the level of severity and likelihood, focus on addressing high priority risk first. Consider factors such as the number of employees exposed, the frequency of exposure, and the potential for severe consequences when prioritizing risk. Next, self-protection equipment. Personal protective equipment, also known as self-protection equipment or alert, is essential for safeguarding individuals from workplace hazard and minimizing the risk of injuries or illnesses. Is designed to create a barrier between the wearer and various workplace hazards. There are some common tips or personal protective equipment. Number one, head protection. Hard head, hard heads protect the head from falling objects, electrical shocks, and other impacts. Bump caps provide leak-twist protection against minor head bumps and laceration. Number 3. Eye and face protection. Safety glasses shield the eyes from laying debris, chemical splashes, or harmful radiation. Face shields cover the face to protect against bigger debris, chemical splashes, or infectious material. Number 3. Hearing protection. Earplugs is into the air canal to reduce exposure to loud noises. Airmove covers the air to dampen noise and protect against hearing damage. Next, occupational health and safety training. Occupational health and safety training is crucial for creating a safe and healthy work environment. It equips employees with the knowledge and skill to identify, manage, and prevent workplace hazards. Here are key aspects to consider when developing and implementing training. Pertama, number one, legal recruitment. Ensure that the training program aligns with relevant occupational health and safety laws and regulations. Compliance with legal recruitment is essential for both employee safety and legal protection for the organization. Number 3. Risk assessment training. These employees have to identify workplace hazard and assess the associated risks. This includes understanding the potential consequences of this hazard and evaluating their research. Number 3. Safe work practice. Provide training on safe work practice and procedures specific to the industry or workplace. This may include proper lifting techniques, equipment operation, and emergency procedures. Next, workplace safety culture. Workplace safety culture refers to the shared values, beliefs, attitudes, and behavior related to safety within an organization and reflect the commitment of individuals at all levels, from leadership employee to priorities, and promotes a safe working environment. A positive safety culture is essential for preventing accidents, reducing injuries, and fostering overall well-being among the workforce. There are key elements and characteristics of strong workplace safety culture. Number 1. Leadership commitment. Visible leadership. Leadership demonstrates a visible commitment to safety by actively participating in safety initiatives, communicating safety expectations, and leading by example. Resource allocation. Adequate resource, both financial and human, are allocated to support safety programs and initiatives. Number 2. Employee involvement, participation and engagement. Employees are especially involved in safety-related decision-making process, hazard identification, and the development of safety procedures. Open communication. There is culture of open communication where employees feel comfortable reporting safety concerns, incidents, or nurse visits without fear or reprisal. Safety training and education. Continuous learning, regular safety training, and education programs are implemented to ensure that employees are informed about safety procedure, hazard recognition, and the proper use personal protective equipment. Next conclusion. In conclusion, a robust occupational health and safety program is imperative for the well-being of employee and the overall success of an organization. By reducing safety creates a positive workplace culture that is characterized by leadership commitment, employee involvement, continuous training, and a commitment to accountability. Effective occupational health and safety training equip employees with the knowledge and skill identify, assist, and mitigate workplace hazards. This coupled with the purpose use of personal protective equipment have created a comprehensive approach to safeguarding against potential risks. A positive safety culture is not only legal and ethical responsibility but also a strategic investment. It contributes to increased productivity, reduce absenteeism, and improve employee moreover, and demonstrates a commitment corporate social responsibility and foster a positive public image. Continuous improvement is key in maintaining a strong safety culture. Regular evaluation, feedback mechanisms, and a commitment to learning from incidents are essential for refining safety process and addressing emerging risks. In NCC, our purpose safety culture is a shared responsibility that extends from leadership to every individual within the organization. By embedding safety as a core value, organization can be create a work environment where employees thrive, risks are minimized, and the overall success of the organization is the sustained. I can express thank you. Wassalamualaikum warahmatullahi wabarakatuh.